So, welcome to Reclaim Vitality, a video series dedicated to helping high performing women break free from burnout and reconnect their energy, confidence, and joy. I am your host, Dr. Anna Lowe, and I am an Ivy League trained physician, functional, and integrative medicine doctor. And I am here to share with you how to help women to take charge of their health and stop settling for feeling exhausted, dismissed, and not quite like themselves. So, in this series, we're diving into one of the most important and most misunderstood topic, and that's perimenopause, menopause, and postmenopause. Today's conversation is all about understanding what these stages actually mean, how to know where you are, and why the symptoms often show up in ways women don't expect. I'm thrilled to welcome Dr. Amy Hawkins, a licensed naturopathic doctor and North American Menopause Society certified practitioner based in North Carolina. And with over 20 years of clinical experience, Dr. Hawkins has helped countless women navigate hormonal changes, understand the full picture, connecting stress, nutrition, gut, hormone, and metabolism to help women move forward. Dr. Hawkins, I'm so glad you're here because we've both been doing this hormone thing safely and effectively for a while. So it's wonderful to be able to really dive in and have a casual, wonderful conversation.
Yeah, likewise. I'm so glad to be here. Thank you for having me. I love this conversation, so let's do it.
Wonderful. So the format, we're just going to throw out some questions that we commonly hear, and then we'll just kind of
Mhm.
share what we thought.
Yeah.
This is the first one. I'm gonna have you try it first. So when women say menopause, what are we actually talking about?
Menopause is usually how women refer to kind of the whole constellation of symptoms across the transition of going from a menstruating female to not a menstruating female. But menopause is actually, to give it some clarity, just really a single day. It's when a woman has not had a period for 12 consecutive months. So really, if we're being more accurate, what we want to refer to is perimenopause, which is the time period leading up to menopause, which again is that 1 year mark after the last menstrual period, or postmenopause, which is all the time after that 1 year mark, after the 1 year period, or after the 12 months of having no period.
Yeah, in that cycle, right? I think when we talk about this cycle of these three stages, it's also just even helpful to think about women actually go through many different stages too, right? From puberty, right, childhood to puberty to right, what's that stage when we're well, post puberty is then premenopause where we have regular cycling hormones and periods, and
Yeah.
then we would then eventually get to a perimenopausal stage, and then menopause is that one day that happens, and then when we flip into postmenopause. Can you walk us through how women can actually recognize in our body during those stages? Like, what are the things that, uh, how do we know we've actually entered into perimenopause?
Yeah, well, that's the golden question. It is kind of difficult to know because really, I mean, obviously we know when we're in menopause if we haven't had a period for a year, but perimenopause is a little more difficult to define. There's no one diagnostic criteria. There's no really clear set of symptoms that we can look for, but when you're working with a menopause-informed practitioner, then we're looking for kind of that constellation of symptoms combined with your age and also making sure that it's not something else going on. So it can be tricky. So generally speaking, I think awareness is really important for women to know that perimenopause, again, it's the time leading up to menopause, right? And that period can last for up to 10 years before that last menstrual period. So it can come a lot earlier than we expect. The average age for menopause in the US is age 51 to 52. And so if you think about those symptoms coming on up to 10 years prior to that last menstrual period, that can be your early 40s. And some women actually have menopause much earlier than the average age, right? So they might go through menopause at around 45. which means the symptoms could begin up to 10 years prior to that, which would be around age 35. So it can really come on a lot earlier than we think. Usually when we're in a really busy phase of life, we're maybe raising kids or maybe at the height of our careers, maybe we're taking care of aging parents, usually really in the thick of life. Women start to notice things are shifting. And so what they're feeling are the early hormonal shifts that come with perimenopause. Um, Usually the first symptoms that are noticed are, cognitive changes, maybe some fatigue, maybe some irritability. So it's really subtle and can very easily be blamed on stress. So women will typically go through that period and having some vague, difficult to diagnose symptoms for quite a long time before they really start to see changes in their menstrual cycle. And when you start to see changes in your menstrual cycle, then that's a little bigger clue that, okay, perimenopause is upon me. It's usually where women start to take notice of that and start to think about it more. Obviously, as your period changes even more and more, and then when you stop having a period, then menopause is arriving. It's a little easier to define. And then postmenopause, of course, once we've gone a year without a period, that's very easy to recognize.
Yeah, and I feel like there's often just buzzwords, right? One of the biggest one is actually not feeling like myself. In fact, they actually even like did a study called,
Mm-hmm.
right, like during menopause or
Mm-hmm.
perimenopause, how many women actually about 50% reports that they simply just don't feel like themselves. So that in itself it's a symptom because it's actually accounts for the myriad just ways we feel. It's just like women. We have a complex ways of describing how we feel, and it might
Yeah.
be, just like you say, a brain fog. It could be irritability, anxiety, or worrying, or like not being confident in the way we make decisions. And partly it's because we have so many, we have all the estrogen receptors, all three kinds of estrogen receptors are actually in our brain. And so we feel it when we start having um, that decrease. And actually, as
Yeah.
I'm thinking, one of the things we could, the way I would actually talk about perimenopause is imagine the gas meter in a car, and perimenopause, menopause is actually when the estrogen is really going towards the low, where it's coming to empty in the fuel. But perimenopause, it's contrary to how people actually think about that. Oh, it's just slowly over time, linearly going down. It's what they call a zone of chaos, which I love this term when I heard it. It's just all over the place. Some days you're high, some days you're low, and your body just kind of indecisive what to go. And that's kind of really why a lot of the symptoms are, just very different for different women and very different at different parts of the year during the perimenopausal for the same women. What other kind of buzzwords do you hear when your patients come in and talk about it, and you're like, wow, that's a typical description of what perimenopause is? What are some ways for people to hear those terms and be like, that's me?
Yeah, yeah, everything you mentioned is spot on, and that symptom of not feeling like myself, which so many women say, it's so important and so commonly heard that, I mean, they literally did a study on it, and it is a valid symptom to report. So a lot of women think about hot flashes when they think about menopause and perimenopause, and hot flashes are a very clear symptom of the hormonal shifts with perimenopause and menopause.
How would
But
you
they tend to come later. Sorry,
how
go ahead.
how would you like, so if someone says hot flash but they've never had one, right? So what are varieties of description or symptoms of hot flashes have you actually seen when people come and tell you about them?
Yeah, so women will just, I literally feel hot. Wonder if somebody turned the heat up or turned the AC down, what's going on? Is it hot in here? A lot of sleep disruption can occur, so women might actually report waking up in the middle of the night and being sweaty, having night sweats. So sometimes that can be more of a clear symptom. And then a lot of times that symptom is brought on by stress or, feeling a little more anxiety. So when you're under a little higher pressure or in a bit of a hurry, you'll feel a little hot. And it can be really subtle in the beginning, and it can become a little more clear as time goes on and you get closer to menopause. And so we think about that, but again, that tends to come on a little later. And like you mentioned earlier, it's those cognitive symptoms that typically are kind of the first shift. So fatigue and brain fog are the two that I hear the most often in my practice, and I'm sure that you do as well. Just I can't keep up, I can't work out like I used to, I don't have the energy that I used to, I need a nap, that kind of thing. And then the brain fog where women are reporting, I've always been able to balance everything. I've always been able to keep up and be everything for everyone and, perform really well at work. And now I feel like I can't keep track of everything. So,
Yeah.
um,
A good term is actually having the brain being available at the drop of a moment, of a drop of a notice, right? Like just having that accessibility to our cognitive abilities. I think that's a lot of my, professional working women really find challenging is all of a sudden like they have a work day where they're just not functioning in that same level and pace. Um,
right, right. And with that, more irritability, more volatility, changes in your mood. Really mood swings are what women usually say to me. I'm having mood swings. Again, I don't feel like myself. I'm losing my temper with my kids and with my husband. What's going on? And it's interesting because when, we going back to the not feeling like myself, the top 5 symptom groups that were reported when women reported not feeling like themselves were anxiety and hypervigilance, fatigue and pain that kind of accompanied that fatigue, brain fog, sexual symptoms like low libido, and then, the study in particular says volatile mood symptoms, so I would more commonly refer to that as mood swings. So we can also see things like heart palpitations, vaginal dryness, weight gain is a classic symptom, but really just a wide variety of symptoms that can be hard to put your finger on. And a lot of times women go to their doctors and say, I don't feel like myself, what's happening to me? And what's the common refrain that they hear from their doctor? I know you can fill in the blank there.
Yeah, yeah. The two that's most unexpected for my patients is actually one is the pain, the aches and pains. And
Mhm,
what's really interesting is it's true, like there's just more, joint pain, frozen shoulders, or
mhm,
right, unprovoked. You didn't have an injury, but now my shoulder's really achy, or my joints
mhm,
really hurting, my hands really hurting. And
mhm,
often when they go to the doctor, it would not, there would be no positive findings. And that in
mhm,
itself, when they did a study, I also find that that's a very common complaint for perimenopausal women or menopausal, postmenopausal women. Another
mhm,
another one I think you mentioned too, it's palpitation. I think women don't really think about it. Heart disease is still the number one killer and in the United States. And so it is often very worrisome. And if you've not had any, most women, don't have, if you're relatively healthy, you don't have
mhm,
actually, heart symptoms, right? You don't even feel a high blood pressure, let alone suddenly having palpitations. So it can be very
mhm.
jarring. And often that sometimes it's the first sign of, of pairing with a little anxiety and pairing with that palpitation. It can be very disarming for my patients.
Hmm. Yeah, yeah. And so women go to their doctors and say, I'm having all these symptoms, what's going on? And the classic thing they hear is, oh, well, your labs look fine, everything's fine. So women are unfortunately often left with answers. I think thankfully there's a lot more awareness now. There's a lot, obviously, a lot on social media, a lot more conversation in the medical community, a lot of catching up around menopause education. So most healthcare providers are becoming more aware and hopefully are considering perimenopause as part of, their differential diagnosis, and not just being sent away with, being told your labs look fine, everything's fine, have an antidepressant and have a nice day. That's hopefully we're moving away from that, but I think that a lot of women are still getting that answer, which can be really disempowering, really frustrating, and, unfortunately leave women feeling like they're in it all alone and nothing could be further from the truth because there are practitioners like you and I who we get it, right? We have the education, we have the understanding, both professionally, clinically, and personally. We're walking through it ourselves, so we get it.
Yeah, yeah. I think you, right, like I think you're giving us a preview of what the next conversation we're having, because we're going to have another episode, which is really about, well, now that we know we're in perimenopause and we feel this way and it doesn't feel really good, do we really have to wait 10 years to do anything about it? And we didn't even talk a little bit about postmenopause, what that symptoms could look
Mhm.
like, which I want to
Mhm.
spend a moment there.
Yeah.
But I think what we're going to talk about next time is actually, right, can we actually look for that in labs, right? Can we actually bring this conversation more directly to the doctor and say, well, can we have hormones? Can we have other treatment supports? And
Mhm.
is it safe? Should we be afraid? Because I know there's been a lot of fear around some of the old studies and information out there, some myths and some, certain truths and myths. So we're going to talk all about that next time. But I want to kind of bring back up, right? There's two more things that I think is going to tie into the postmenopause is sexual health, right? It starts in perimenopause and to postmenopause, and actually bone health that we didn't really talk about. Um,
Mhm.
do you mind sharing a little bit about like what are we what's happening to our bones pre perimenopause to postmenopause, and what's happening also just for like in terms of just urogenital health and vaginal health, vulva health, sexual health, right?
Mhm.
Pain with sex and all that stuff. Libido, you mentioned. I would love for you to kind of give a little kind of, you know, share about what are some common things to expect from peri to postmenopause.
Yeah, yeah. So the official term for, the symptom picture that we see in peri and postmenopause is the genitourinary syndrome of menopause. And usually that's going to include some level of vaginal dryness, pain with intercourse, and maybe some recurrent urinary tract infections. We also kind of put loss of libido in that category, but libido is also in your brain. It's not just, a genitourinary syndrome. So, women have a high level of variability in those genitourinary symptoms, but it's important for women to know that if they are having some vaginal dryness, if they are having some loss of desire, if they are having frequent urinary tract infections, that is absolutely in this phase of life going to be related to the declining impact of hormones on that vaginal tissue. So first, usually it's progesterone that's, going down and, up and down, and then estrogen starts to fluctuate. And as we are losing that hormonal stimulation of that vaginal tissue, it thins and becomes less moist. So, that is going to bring up symptoms, and there are many treatments for that. So it's certainly not something to ignore and just kind of power through. Do you want to talk about osteoporosis?
Yeah, yeah. Actually, just to add to that piece too, I actually have a lot of women that would be suddenly have more yeast infections,
Oh, yeah.
or right, just
Hmm.
generally, or bacterial vaginosis, or just like have different kind of they notice much different like mucus, right, or
Hmm.
smell, and just during this
Yep.
period of time. And the good news, it's super treatable, and and it's very safe. And so I think this is another awareness too, and we'll talk more about that in the next couple episodes.
Yeah.
Bone health. Two things that I'm very anecdotal the way I like educate, right? So I feel like often women at 65 is when they like, I'm finally getting my DEXA scan, and now all of a sudden I'm osteopenic or I'm osteoporosis, which means that my bone density is below optimal or just sub right, like or just
Hmm.
borderline.
Yep.
And then they're presented with options to say, well, now you want to treat, versus thinking about, well, at what point did this start? And
Hmm.
it turns out at perimenopause, when we start dropping the estrogen, we actually stop uh, we sorb resorbing bones as well. So for women, we have two phases around bone loss.
Hmm.
Whereas men has the one phase which is age related. Women actually have estrogen or hormone related and age related. And so we go through that earlier when we're starting to have less hormones. And that begins, women start having the highest testosterone we have is in our 20s, and then it just starts going down. Estrogen is, in our 40s and 30s and 40s and 50s, and it starts going down. And progesterone, right, and progesterone is the first one, as Dr. Amy Hawkins mentioned. And so really for bone loss, Often it's not felt, but pairing with the muscle, pairing with the metabolism, pairing with our fat distribution, it is actually a very crucial time that we realize it's happening. I think the most important symptom is that because we can't feel it, we actually don't know it's happening and we don't prepare for it. So it's more around awareness and education. So we know that these are actually all part of the musculoskeletal health during the perimenopause years that we can absolutely support so that it's not just completely deteriorating, because otherwise it's just a declining. Do you
Right.
have anything
Yeah.
to add to that?
Just adding an awareness that, the most rapid rate of decline in bone mineral density is going to be in the first 5 years post-menopause. And so it's really interesting the timing of how we screen women for osteopenia and osteoporosis, right? So standard screening is done at age 65, correct? And so that is, possibly 15 years post-menopause. And so when we think about HRT, which again, we'll get into this more in a subsequent episode, but we know that, HRT is safest if it started within 5 years of menopause, or sorry, within 10 years of menopause or before the age of 60. So if we're not screening women for osteoporosis and osteopenia until age 65, we've potentially missed a critical window to support their bone mineral density when initiating HRT would have been safest. So I am a really strong advocate. Actually, this is something we haven't talked about outside of the podcast one-on-one, but I'm a very strong advocate for much earlier DEXA screening around the time of menopause, whenever that is for you, and absolutely, pretty much mandatory in my mind if you have a family history. So your mother, grandmother, or sisters have had osteopenia or osteoporosis. It's a bit of a soapbox for me.
Yeah, yeah. I actually, to here in the Bay Area, I actually, even if they're not candidates for their insurance to cover, it's actually very reasonable price to do pay out of pocket to local, often same places that does imaging, does ultrasound, does X-ray. They are actually have the capacity, so that's
Hmm.
always an option to pay out of pocket to do that. So we're
Yeah.
coming to the end of our time, and I always ask my guests one question, which is if you were to tell your younger self one lesson you've learned from this topic, what would you want your younger self to know?
Oh, my younger self, I would tell her if you're in midlife and I know you have a lot going on, but your symptoms are real, trust that intuition, go talk to your doctor and get some answers. And I also tell her, it may be perimenopause, but it also may not be because you are at much higher risk for a lot of other things going on at this time in life, blood sugar changes, metabolic syndrome, insulin resistance. Sorry, that means insulin resistance. Um, Hypothyroidism, Hashimoto's thyroiditis, a lot of other things start to come up in midlife. So it's so important to have that conversation, have the workup, have a menopause informed practitioner, and, figure out what's going on for you.
Great. And you see patients in North Carolina,
Yeah, yeah, yeah. I see patients in
virtual
North
and
Carolina virtual.
okay.
Yep.
And I will post your information, but what is your website?
drhawkinsnd.com. And you can also follow me on Instagram. It's at Dr. Amy Hawkins.
Lovely. So, Dr. Hawkins, thank you for this really important conversation. I think one of the biggest takeaway for me is that women do not need to wait until life feels completely derailed to start paying attention. So, if you're feeling off, just like Dr. Hawkins says, talk to your doctor, start getting support. And to everyone listening, if this episode helps you, better understanding what's happening in your body, share it with a friend who needs to hear it. And in our next episode, we're going to talk about hormones, lab testing, treatment options, and really dive into understanding the fear of why so many women still carry around hormone replacement therapy. All right, see you next time.
Thank you.